Last year, a total of 45,029 candidates from 103 accredited nursing and midwifery training institutions wrote their national examinations. Of these, 4,309 were students in their final year, while 40,720 were continuing students. Today, the results of 4,309 finalist students have been released. Of these, 2,237 were candidates for certificates, while 2,072 were candidates for diplomas. The results have indicated that 2,044 candidates passed their exams, and of these, 189 passed at the distinction level, 1,364 passed at the credit level, 491 were at the pass level, 178 were ungraded, while 15 didn't sit the exams.
I wish to inform you that there is an improved performance of candidates at both certificate and diploma level in December 2019 compared to performance of December 2018. The diploma level candidates performed better with a pass rate of 97.3%, while the pass rate at certificate level was 91.4%.
However, Chairperson of the Uganda Nursing and Midwives Examinations Board, Maria Molusimbi, has called for a revision of the nursing and midwifery curriculum to allow for both day and evening studies so as to cater for the rising number of students.
Right now, they don't go for night duty, but we should train them on how to work during that shift because that's where they learn most. This will decongest the practicum sites and enhance skills acquisition as well.
In her remarks delivered by the Minister of State for Higher Education, J.C Muyigo, Education Minister Janet Museveni has urged medical students to take an interest in courses around mental illness and palliative care.
We all know that there is increase of mentally ill patients and non-communicable diseases. This calls for increased training of mental health, palliative care, and public health nurses to mitigate the challenges.
The minister has also warned medical students to desist from rejecting placements in rural health centers because that is where their services are needed the most.
We have known of health workers who shun working in rural communities, and yet this is where the largest population of our people live and where the greatest need for health care is also found.
Because of the staffing shortages within the country's health sector, the onus has now been placed on the Uganda Nurses and Midwives Council to facilitate the registration of all the successful candidates to make sure that they can start practicing as soon as possible and fill these gaps. Joyce Nakato, NTV Weekend Edition.